I'm Dr. Ken Erickson, developer of the ProMaker method and creator of the Step Up to Ultimate Performance program. It looks like we have another question here that I'd like to answer. And that question is, how do I know if I need knee surgery? That's another common question, another common issue that a lot of people will have. There are several different things that can kind of go wrong with the knee. Some of them are things that can actually be fixed without surgery, even if the tissue damage is fairly significant. There are other problems, unfortunately, that probably would end up requiring surgery down the road. Let's cover the ones that are kind of the worst ones that would actually require surgery. I would say the meniscal tears are among some of the worst. The meniscus is actually a pad that separates the two bones, the two major bones of the knee, and it kind of operates as kind of like a shock absorbing pad, and it also creates kind of a slick movement for the knee joint. If there's significant damage to the meniscus, a tear across the meniscus, it's difficult for that to heal on its own. It is possible to do so, but the problem you run into is that there's no direct blood supply going into the knee joint itself. So the only oxygen and nutrients that you can get into the joint are coming from joint movement. If the joint movement isn't very good because it's painful and because you have this meniscus problem, you may find that you can't get enough oxygen and nutrients into the area without causing more damage to the meniscus and just exacerbating the problem. So unfortunately, in severe circumstances, that can kind of occur. If it's a very small meniscal tear, and it tends to be more off to the side and not central into the middle of the meniscus, you may find that altering your joint movements could actually help. And what you might find is that tear may have actually occurred not because of initial trauma, even if the pain came with an initial trauma. You may find that the tear initiated with an actual long-term joint dysfunction, an inefficient joint. That inefficient joint motion may have actually led to the separation of that tissue. If that's the case, then you might find that reestablishing more efficient motion to that joint, along with maybe some more balanced muscles, if that was an issue before, could actually move the center of movement of the joint away from the area of tear, which could give it enough time to heal. That way you can actually move the joint, get the oxygen and nutrients to the joint without actually causing more harm to it, and you might actually be able to reverse that problem up. But you'll find, unfortunately, as with most tissue that doesn't have a direct blood supply, it's a very slow healing structure. It could actually take anywhere between 9 months and a year for it to fully heal, even if you get to a point where you're not feeling any symptoms at all after a couple weeks to a couple months. So you got to keep that in mind. Other problems, like pain behind the kneecap, in my experience, has been almost always related to some kind of chronic joint dysfunction, usually an imbalance between the IT band, the iliotibial band, and the vastus medialis obliquus on the inner part of the knee. So, or some kind of imbalance as well between the quadricep and the hamstring. So if you see an imbalance along those lines, correcting that imbalance can do wonders for the knee, and you'll oftentimes find surgery for those types of problems tends to actually not be very effective. So even if you've had surgery for that kind of problem and you haven't had any improvement, you might find that going back to the basics and looking at the joint biomechanics, the muscle balance or imbalance in that particular case, or some other kind of dysfunction that you can identify with using the ProMaker method, you might be able to find correcting those things could have huge impact, even if you have a failed surgery for something along those lines. But let's hope you don't go that route. Let's hope you identify those beforehand. So hope that answers your question, and I will see you around the academy.